All right, we'll just give it a moment for people to log in. All right, well, why don't we go ahead and get started? Good afternoon, everyone. I wanted to begin by thanking everyone who's joined us today. We recognize how busy life is, especially given the many new roles we are all now having to juggle. And so we really appreciate you taking the time this afternoon to join us for this webinar. And so before we get started, for those of you who are a part of our School of Medicine community, our continuing medical education colleagues have worked hard within a very short time frame to make sure that webinars such as this one are eligible for CME credit. So as you can see on this first slide, this is information on how to receive the CME credit, and we will again be listing this at the end of the presentation. Next slide, please. So welcome again to those who are just joining us. My name is Dr. Elizabeth Reichert, and I am a child psychologist in the Department of Psychiatry and Behavioral Sciences at Stanford. I direct our Pediatric Anxiety and Traumatic Stress Clinic and co-direct the Stanford Parenting Center with Dr. Mari Kurahashi. Today's webinar is the first in our Fall Positive Parenting During COVID-19 series, hosted by our department and spotlighting some of the incredible members of our Stanford Parenting Center team. We will have 2 additional webinars coming up in December and January that are listed here on the left side of your screen. One that will be covering the challenges of remote learning and what you can do as a parent to best support your child. And the other discussing the topic of screen time, how our ideas of screen time are shifting, and what we need to know about how to manage some of the challenges we are all facing as parents on this topic. And for those of you who are new to our webinar series and joining us for the very first time, welcome. And please feel free to check out our past webinar series from the spring, which can be found on our website that's listed here at the bottom of the slide. We will also be sending an email following today's webinar with this information. And in addition, we have an exciting new resource that we wanted to share with you that's listed here on the right side of your screen. Starting next week, we will be offering a more personalized resource for parents, what we are referring to as our positive parenting consultation groups. And so these are going to be small groups that are designed to build on the information provided during our webinars and provide additional education and scientifically based tools to support your child or adolescent. And we're recruiting now for our Pediatric Anxiety and Stress group that will be starting next Monday with Dr. Fedigan. This group will provide further information pertaining to the core parenting principles that are helpful for youth with anxiety and increased stress. Each of our group series will run for 4 weeks, and we will be organizing groups in the upcoming months based on your interest. If you are interested in this first group or upcoming groups, please look out for an email following today's webinar to register to learn more. Next slide, please. So now I'd like to just reiterate a warm welcome to everyone who's joined us today for our webinar. Is it stress or a pediatric anxiety disorder? Tools to help kids cope and when to seek treatment. The emergence of the COVID-19 crisis has had a sudden and profound impact on families across the country. In the past 9 months, the crisis has shifted from a focus on short-term stressors to long-term fears and uncertainties, and parents are reporting a substantial impact on their own mental health and that of their children. Stress in children and adolescents is complex under usual circumstances. And in a crisis like this one, it is more important than ever that we bring our attention to the emotional health and well-being of our families. This afternoon, we are so fortunate to have Dr. Shea Fedigan and Dr. Sabrina Leger with us today. They will be bringing attention to the important differences between stress and anxiety facing our youth and what we as caregivers can do to support our children during this time and beyond. Dr. Shea Fedigan is a child psychologist in the Department of Psychiatry's Pediatric Anxiety and Traumatic Stress Clinic. And Dr. Leger is a child psychiatry fellow in our mood and ADHD and externalizing disorders clinics. Both doctors are also integral members to our Parenting Center team, and they share a passion and expertise in supporting anxious youth and their families. We will spend the first half of the webinar today on presentations, and then we will have some time for a question and answer session. So please feel free to submit your questions through the chat function that's located down at the bottom of your screen, and I will be monitoring these questions throughout and will facilitate the Q&A at the end. So now I'm going to turn it over to Dr. Fedigan and Dr. Ali Leger.
Thank you so much, Dr. Reichert, for that lovely introduction into our topic today and for us. I want to thank everyone for joining us this morning. Dr. Fedigan and myself are really excited to be presenting on this topic, especially given the current social and environmental climate that we're in. Our presentation today is called Is It Stress or a Pediatric Anxiety Disorder? And our goal is really to provide a better understanding of stress and anxiety and ultimately share tools that parents can use with their kiddos in navigating this. Next slide, please. So what is stress? Stress is how the brain and the body responds to a challenging demand, such as performing at school, a significant life change, or any traumatic event. And stressors may be a one-time or a short-term occurrence. It can happen repeatedly over a long time, or can be a chronic and persistent challenge. More importantly, though, it's always important to remember that stress affects everyone. Next slide, please. So why do we feel this way? Our current understanding is that emotions evolved quickly as a way to organize all of our cognitive functions when necessary. So for example, when we casually encounter a saber-toothed tiger, as people do, we become fearful. The fear emotion sharpens our senses and creates a physiological change in our body that allows us to better survive the threat. So essentially, our sympathetic nervous system gets turned on and triggers this fight or flight response to either fight off a life threat or flee from an enemy. And this sympathetic nervous system also signals the adrenal glands to release hormones like adrenaline and cortisol that ultimately allows for a rapid response to a perceived threat. What this quick response system allows us to do is bypass the much slower cognitive processes that would be needed to consciously acknowledge that the saber-toothed tiger is a threat. And by the time that the slower response system is acknowledged that there is a tiger there, the person may have already been eaten. So from there's this hypothesis that actually evolution selects for anxious genes. A possible evolutionary advantage for anxiety could be that worrying about danger would typically lead to someone taking fewer risks, seeking safety, and focusing on doing things well. Next slide, please. There are also some fears that elicit very typical physiological and psychological responses, and kids, depending on their age, will have a variety of fears that we would consider developmentally appropriate. The intensity of these fears can affect different kids differently. However, as kiddos develop, they will frequently outgrow them. And so here on the slide, you have a diagram showing the typical fears during different developmental periods. So for example, for 2 to 4-year-olds, common ones include, the potty, the dark, shadows, sleeping alone. In the 5 to 7-year-old period, the dark again, fire, maybe bad guys, taking tests. The 8 to 11-year-old category or group, bad guys you see again, ghosts, being home alone, dying, sickness, school failure in this group. And then the 12 to 18-year-olds, there's safety, sickness, throwing up at school, failure in school or at sports, violence, and global issues. And what you'll notice is that some of these kind of persist for multiple categories, but many of them also kind of taper off. Next slide, please. And so I want to go through with you guys a little bit the body's physiological response to stress. So back in the 1930s, Dr. Shea discovered that there are actually 3 stages in the body's response to stress. First, we have the alarm reaction, which is the first stage. And this is when the body begins to perceive and be aware of the stressor. So in this initial reaction to the stressor, numerous physiological responses occur. Your nervous system gets involved, which triggers your adrenal glands that are responsible for your stress hormones. This then causes body-wide changes, including increased oxygen and blood supply to the necessary areas of your body. And this can lead to rapid breathing and a faster heart rate. So initially, which is actually depicted here in phase 2, the individual's body may be inefficient at responding to the demands placed on it, but over time, the body adapts and increases its ability to meet the demands that are being placed. And so then we enter the second stage of the general adaptation syndrome, which is when the body increases its functional capacity to adapt to the stressor. And this is called resistance development. And the body becomes prepared for the fight or flight response. It's when a set of slower hormonal reactions are triggered, all designed to boost, support, and then maintain the actions of the alarm stage. And then we head to the last stage, which is exhaustion. This is when the body becomes exhausted in its response to the stress, and it can occur when there is a prolonged stress or intolerable amounts of stress, which produces fatigue. It's very rare to progress to this stage, and it's really reserved for those under prolonged periods of stress, such as severe trauma. But essentially here, the stress response doesn't switch off. For most stress responses, however, the body eventually returns back to normal, and then you have kind of the continuation of this cycle. Next slide, please. So is stress good or bad? As we've been talking about it, not all stress is bad, and actually, our response to stress in dangerous situations can be really helpful in quickly signaling the body to act. So prepare to face a threat or flee to safety. However, rather than needing to keep an eye out for that saber-toothed tiger, today's stress is often caused by overwhelming workloads, relationship issues, even perhaps financial pressures. And if it continues to persist, these stressors can be physically and emotionally harmful. And too much stress can lead to poor performance in work, school, sports, and other things. However, in smaller doses, stress can actually prime a person to take action. So let's say in a non-life-threatening situation, stress can motivate people, such as when they need to take a test or interview for a job, or if they really need a wake-up call to get back on track. The notion of this, or this idea of priming, was actually highlighted by two prominent psychologists, Dr. Yerkes and Dr. Dodson, who studied this relationship between stress and performance. And their findings, depicted in the Yerkes-Dodson curve, which you'll see here on the bottom right, is that it asserts that your physical and mental performance can be improved when you undergo physiological or mental arousal, so the stress response, placing you in the zone of this optimal functioning. The caveat to this, though, is that when levels of arousal become too high, your performance then decreases. And so the key is to reach optimal performance without really tipping over into that anxiety and that burnout section of the curve. Next slide, please. So I want to go into kind of long-term stress. And coping with the impact of chronic stress can be really difficult because the body does not receive a clear signal to return back to that normal functioning. So with chronic stress, the same life-saving reactions that occurred in the body that were so helpful in initially responding quickly to a threat, over a long period, this can disturb the immune, digestive, cardiovascular, sleep, and reproductive systems. Additionally, this continued strain on the body from stress, without being able to cope appropriately, may contribute to serious health problems such as heart disease, high blood pressure, depression, or anxiety. So it actually becomes very important to recognize when stress levels are getting too high. What's helpful is that many people actually develop red flags or signs that can signal to others and themselves that they're stressed. And these reactions can occur psychologically, physiologically, behavioral, or some combination of all three. The most common symptoms are those on the body, so such as headaches, muscle tension, chest pain, fatigue, upset stomach, and sleeping problems. But emotionally, you might see things like increased anger, irritability, indifference, kind of quickly reacting to situations, self-defeating statements, or a loss of confidence. Behaviorally, you might see maybe a change in sleep pattern with poor sleep, lack of focus, poor performance, loss of appetite, engaging in substance use behaviors, and maybe a change in motivation. Cognitively, you might find that someone is more frequently sharing worried statements, negative thoughts, maybe foggy thinking, impaired judgment, impulsivity. There can be also actually other areas where you can notice these red flags or signals. And that can be kind of in an imaginal frame where some experiences like flashbacks to past failures, feelings of embarrassment or helplessness can really start to emerge. Relationship dynamics can change with someone maybe withdrawing a little bit more or even becoming more argumentative. And even some subtle changes in sensory experience, such as becoming cold and sweaty, clammy, or changes in the pain threshold that someone experiences. Next slide, please. So I want to take some time here to really talk about the individual's response in terms of stress and their adaptation. And there's actually a variety of different factors that influence how an individual person will experience and respond to stress. So firstly, there are the genetic factors, and we get that from our parents. However, our genes aren't static, and they can shift based on certain environmental situations to create what we call epigenetic changes. And these epigenetic changes are simply this interplay between the genes and the environment, which contributes to a person's personality, proclivity, responses, etc. And there can be a variety of environmental situations, both positive and negative, that can have this effect. But it doesn't really end there. So then you can also have coping related protective factors that can influence how a person will respond. And this really occurs in a bidirectional way. So for example, if you're more prone to having a calm demeanor, overall it might be easier for you to use a calming coping skill. However, it also works in the opposite direction. When people are able to effectively use a calming coping skill, this can create changes in the body's response system. So all of these factors come together to govern a person's neural networks, neuroendocrine system, and hormonal system, which then leads to a particular response in a given situation. And we really can think of a person's continued response as existing on this spectrum between increasing their risk or increasing their resilience. So I know that there's kind of a lot on this slide and a lot going on. So I just want to recap a little bit because I think it's important. The environment and coping related protective factors, in addition to the genes, can really affect someone's physiological, psychological, and behavioral responses to stress, which then either increases their resilience or increases their risk. Next slide, please. So I want to talk a little bit about resilience. What is this resilience? And it's really defined as the process of adapting well in the face of diversity, adversity, trauma, tragedy, threats, or significant sources of stress. So for example, like family and relationship problems, serious health problems, school stress, whatever it might be. So boiling that down a little bit, it's really this ability to bounce back from difficult experience. And I think it's important to remember that resilience is not static, but it's like building a muscle. It can strengthen over time with practice and intentionality. And so aspects that can be helpful in building resilience are connection, well-being, healthy thinking, and really finding meaning. In a moment, I'm going to talk a little bit about different coping skills that can help us do that. But before I do, I just want to highlight the aspect of healthy thinking for just a moment. Because a part of healthy thinking is focusing on what is in your control. So having a positive attitude, or more particularly, simply being aware of the negative thoughts that you're having and making sure to double check their accuracy. Things like having self-efficacy by being able to solve problems and overcome challenges. Accepting that change happens all the time and that no one particular thing is permanent. And of course, ultimately getting help when needed. Next slide, please. So there are multiple strategies, such as taking care of self, social support, and using a coping skills toolbox that can be useful in managing stress. And a big part is finding the right tool for you. So some people will find exercise extremely helpful, whereas other people may find talking to a friend the best way to relieve stress. And so for kiddos, it can be really helpful for them to try different strategies and become familiar with the ones that work best for them. This is where parents can be really helpful in encouraging them to try different options. So in terms of well-being or taking care of self, useful skills can be exercising, having good sleep practices, eating well, and maintaining a consistent routine. Taking a time out or taking a break, which is quite literally walking away from the stress for as little as 5 minutes to help refocus. And this can be really useful. And of course, relaxation. So using a grounding technique by being mindful of what your different senses are experiencing and bringing you back into the current moment. Visualization, where you can conjure up a positive mental image or intention that you want to achieve. And deep breathing, which is one of my personal favorites because it can be done anywhere without anyone else noticing. And the person simply takes a deep, slow breath in through their nose and a slow, long exhalation out through their mouth. Social supports are, of course, very important. And for children and adolescents, it can be a variety of people in their lives, including friends, family, parents, teachers, coaches, religious figures, that can be really useful as providing that support. And then lastly, I want to talk a little about this coping skills toolbox. And this is really a physical container that a child can go to that already has all the items they need to help them calm down and to regulate their emotions. And parents can be really helpful in creating this toolbox and be thoughtful about what goes into the box. Some examples, or some common examples, are like fidgets, bubbles to facilitate breathing, coloring pencils, a coloring book, and a visual reminder to use the relaxation skills. So for example, a cue card that reminds the child to take deep breaths. In the moment, and this is true for pretty much everyone, when our emotions are running high, it's really hard to remember the strategies and other more logical based solutions. And so therefore having it written down as a reminder in those situations can be extremely helpful. And having it all in one place where a child can go to it when they need it is even more so. Next slide, please. So I want to take this moment to talk a little bit about stress during COVID-19 or this particular time. And there really are multiple ongoing challenges during the current pandemic that continue to be persistent stressors. Aside from the virus itself and the safety questions that raises for a lot of people, people are also engaging, our kiddos are also engaging in virtual learning, limited living arrangements, reduced time alone with limited privacy, reduced access to social supports, and really this ongoing balance between professional and personal needs. And these are just a few of the ongoing challenges. And as we've been talking about, people will demonstrate very different responses to these same ongoing stressors. So here's just kind of a quick list of some of the strategies or coping skills that may be useful for kiddos who are feeling this stress. So firstly, I think it's always important to remember that children do take their cues from their parents and other adults in their lives. They can sense stress and tension from adults, even when it's unspoken, and they can often model the behavior of the adults in their lives. So what is useful then is modeling certain behaviors such as identifying and acknowledging difficult emotions. And parents can also practice coping skills themselves or with their children and essentially lead by example. Children can also benefit from open and honest communication about what's going on. So developmentally appropriate discussions about COVID-19 can be useful in working through facts from fiction. But of course, being always mindful not to give more information than they actually need. It's also helpful for children to hear the message that they're safe and secure. So they can be overhearing, worrying conversations between adults, from the media, or even through friends. And it can be important to have a clear conversation about safety practice and how the family is promoting safety. And those can be things such as, hand washing, staying active, eating healthy, socially distancing, engaging with families that are in your own bubble, and a variety of other strategies that are being used. Additionally, or another one is children also benefiting from routine and consistency in times of change. So they can really find security in consistent schedules, routines, such as consistent bedtimes, meal times, play times, which can really provide a sense of safety. And the kind of 2 points at the bottom are additional things that parents consider, such as reading helpful children's books or completing workbooks with their kiddo. There are multiple resources online that have developmentally appropriate material to facilitate these conversations. And also, spending time with your kid in meaningful activities like reading together, playing board games, movie nights, family dinners, whatever works for your family, but those things can be really helpful. Next slide, please. So stress to anxiety, when does it kind of stop being stress and start moving into this realm of anxiety? And one way to think about it is really thinking about it on a spectrum. We know that 1 in 5 children will develop an anxiety disorder and that the rates can increase slightly with age. So I'm actually now going to pass the presentation to Dr. Fedigan to talk more about anxiety and particularly about anxiety disorders. Next slide, please.
Thank you, Dr. Leger. So stress and anxiety affect everyone, but when is it more than stress? So I'm going to review the warning signs or flags of when anxiety goes from worry to a possible pediatric anxiety disorder. And as we look at these, I'm going to kind of come back to them throughout our presentation. So when we're thinking about this, we want to think of compared to kids their age. As we know, there's developmentally appropriate worries, but is this one that's excessive and out of proportion to the situation? Clearly right now with COVID-19, there's a lot of things that are in proportion to the situation that are really challenging. But is this something where they're really magnifying how bad things are and really minimizing their ability to cope with it? We'll also see some kids will be easily distressed or irritated in response to a situation. So that can be overt worry we see, like fear, but it can also be irritability, anger, those types of responses as well. As Dr. Leger mentioned, physical symptoms of anxiety manifest in stress. They also manifest in problematic anxiety, like an anxiety disorder. We'll often see kids describing that they have a stomach ache, a headache, just body aches. I mean, as adults, we often say like our shoulders hurt, our necks hurt. We carry that stress in the body. When that starts to be persistent, maybe they also are feeling restless and having more difficulty calming their body down. That's when we're noticing it might be a sign of something more. Often we see kids will worry ahead of a time, anticipatory anxiety. So even before a situation occurs, they're starting to ruminate or think about the what ifs. What am I going to do? We'll also notice some difficulty with sleep at times. This can be falling asleep at night, so kind of turning their brain off and letting go of the worries. It can also be calming their body down enough when they're having that restless feeling to feel like they can fall asleep and let go of the day. But it can also show up as night wakenings. It can also have as early wakenings in the morning, getting up really early because they're already feeling that anticipatory worry. We also see, which I'll talk about a lot today, is reassurance seeking. Now, this is typical, and we'll come back to it, but of asking a lot of, is things going to be okay? When is that going to happen, mom or dad? Seeking their grown up and looking for extra reassurance more than other kids their age. Avoiding situations that are making them feel discomfort, and difficulty stopping or controlling the worry. Now, as you look at these, we all might say, hey, I kind of have some of these warning signs, because we all experience some of these sometimes. So a caveat here is that the key is that these symptoms are persistent and that they impact functioning. So they really impact the child or the teen's ability to engage with some of the typical things for their age, engage with their family and enjoy regular play as a child. They are having difficulty attending or really completing school tasks, or they're having a lot of difficulty with their social functioning because they're either avoiding situations or they're experiencing so much distress. Next slide, please. So let's take a look at the difference between that transitory or temporary anxiety that we all experience and persistent or problematic anxiety. So here on the left, you'll see that transitory anxiety is pretty reasonable for their age or the situation. Dr. Leger discussed transitory anxiety and these really great typical developmental markers that children and adolescents have for certain worries. These anxieties are important. They build bravery, confidence, the ability to problem solve and to cope. But when we see that the worry is actually out of proportion or out of sync with the actual situation, it's being really magnified or catastrophized, that's when we think of it as more problematic. Similarly, often these anxieties that are transitory diminish over time as kids get used to them, right? They do them, they're used to it. Problematic anxiety is when it actually increases over time. So for example, it's really typical for kids to be fearful of maybe talking to new adults or going new places. However, if that continues and persists to the fact where maybe they actually are making their parents talk for them in any situation, even with people they know pretty well, like their teachers. They're avoiding all new situations and they really struggle to be able to engage in new things because of it. That's when we think about it as it growing in intensity and becoming more problematic. Additionally, in transitory anxiety, that typical anxiety, we see that a child actually benefits from some coaching and small reassurance parents provide or grown-ups provide. But in problematic anxiety, the reassurance is just persistent, constant, and sometimes never even enough. Sometimes there's no answer you could give the child that is going to help them approach that worrisome situation because they aren't able to hold that. Often transitory anxiety actually helps with, like I said, with problem solving, developing resilience. Problematic anxiety actually interferes with growth. It interferes with that ability to develop that resilience. And over time, what can actually happen is that kids will grow to avoid more and more situations. While these aren't indicative entirely of a diagnosis of an anxiety disorder, they're definitely flags their child's anxiety is getting in the way and they're really getting stuck. Next slide, please. So pediatric anxiety is really hallmarked by a persistent pattern of overestimating how bad things are and underestimating one's ability to cope with it or to problem solve. Kids and teens often have to face a lot of challenging tasks. As I said, most things in COVID-19 era and 2020 have been pretty challenging. But the tendency to catastrophize, to maximize negative outcomes, minimize their ability to cope, that's when we're seeing this problematic pattern get stuck. So here I have this image of a kitten where this young girl is overestimating and having this gut reaction. Her first instinct is, this is a terrible, ferocious animal. I need to run away. They're going to eat me. This girl is not able to see and rationalize, well, yeah, it's actually like kind of a small kitten and I don't really know cats and I'm kind of scared, but it's quite small and I'm quite large. My aunt has a cat. It'll probably be okay if I go slow. They're not able to access those skills. This pattern of maladaptive or unhelpful thinking is where kids with problematic anxiety get stuck and where we want to help intervene. Next slide, please. Okay. So as psychologists, we utilize the cognitive behavioral therapy framework to understand this pattern. So cognitive behavioral therapy, or CBT for short, is an evidence-based intervention and model that's the frontline treatment for problematic anxiety. At its core is this cognitive triangle visual here that shows how our thoughts, our emotions, including sensations, and our behaviors are dynamically intertwined and linked. So when we experience a strong anxious emotion, for example, a fear of a dog, let's say, we are also experiencing problematic thoughts. So for example, I cannot go to the playground. There is definitely going to be a dog and that dog is going to hurt me. I know it. And we're also experiencing problematic behaviors or actions, like consistently refusing to go to new places because there could be a dog there. Those things are linked. Our thoughts and feelings actually impact us all of the time, not just when we're feeling overwhelming emotions. So I want you to think about this morning for yourself. Your alarm went off, maybe it didn't. What jumped into your mind? I'll tell you what it was for me. Mine was, you need to get up and send those presentation slides in. That thought generated a healthy amount of anxiety or stress for me and motivation for me to engage in a behavior like getting out of bed more promptly than maybe I would have on a typical day when maybe I hit the snooze button because there's nothing kind of motivating me or no healthy anxiety there. This relationship goes both ways. So when I got out of bed and sent that email, thank you, Mindy, I then noticed I felt happier. I felt accomplished. I felt less stressed. My thoughts were, got that done, now on to breakfast. So my actions influenced my feelings and my thoughts. When someone experiences a problematic level of anxiety, you might recall that the warning signs I went through were not actually around the feeling itself, but actually the impact it had on their behavior and their thinking. We actually don't try to change the problematic feeling itself. Perhaps you've even tried doing this by saying, don't worry about it. I want you to think about your life. How often has it worked when people say, oh, just stop worrying, don't feel sad? It doesn't. So let's take a look at the cycle of anxiety specifically and where we can utilize this knowledge that our thoughts, our feelings, and our behaviors are connected so that we can make some change. Next slide, please. So anxiety tends, but not always, to follow a pretty predictable pattern. And I'm going to walk through that pattern with you guys. So a trigger here in the visual is actually really any prompting event or situation. So for example, let's say a child is having a socially distant backyard play date with a friend. You show up, you got your masks, you have your hand sanitizer, you're eager to have your child spend some social time with peers, and you're pretty eager to have a much needed break. But your child's pretty fearful of dogs. They show up at their friend's house and you see their friend has just adopted 3 different dogs in their backyard. Your child experiences worry and anxiety. That could be complaining, like I said, of a stomach ache, headache, or maybe even overt statements of fear. It can also be extreme anger or irritability. You didn't tell me there was going to be a dog. Why didn't they let me know? This isn't fair. And anxiety can take on many presentations like that. So we got to be on the lookout. But this actually isn't problematic yet. The feeling isn't necessarily problematic. It's what we do because of the feeling that is. So in this case, the child experiences the worry and then says, grown up, mom, dad, I don't want to go. I'm not going. They may claim illness or maybe just flat out refuse. Maybe they say, you got to take me home right now. This is when it's more problematic. They avoid the situation because they want to avoid sitting with and coping with the anxiety. We call this avoidance. Now, sometimes kids and teens can avoid on their own, but often they use adults or grown-ups as accomplices. So in this situation here, if it's a young enough kid, your kid can't drive themselves home on their own. They would need you to take them home. Accommodation, this piece at the bottom of this cycle here, is when we change our behaviors as adults and our routines to either allow, like overtly or covertly, allow our child to avoid. So in this situation here, the scenario, maybe you negotiate with them like, oh, maybe we can have the dogs put inside. Maybe we try to problem solve. Okay, let's just do it at our backyard. Or maybe you say, fine, we'll just go home. We'll do it another time. We'll figure something out. All of this allows the child to avoid the uncomfortable feeling. More here, we'll talk about more on that later. But those behaviors, thinking back to our cognitive triangle, are what allow the anxiety for the child to decrease temporarily and your stress to decrease temporarily. Win-win, right? Everyone's feeling good. No, this actually reinforces or makes much more likely that avoidance and accommodation are the go-to behaviors for when worry around dog strikes again. It really feeds the cycle. The way we break this cycle is by targeting, targeting the behavior. We don't try to reduce or change the feeling or the worry directly, but changing the behaviors of how our child and how we respond to the worry. Next slide, please. Now I want to be really clear, avoidance isn't always a problem. A big theme here is it depends. Dr. Leger reviewed the evolutionary and biological reasonings for avoidance. It certainly could help us if we saw that saber-toothed tiger or coyote in our yard. But often, when we're feeling large feelings of anxiety and worry, it's a false alarm. Our feelings are overestimating how dangerous something is. Avoidance can take on lots of shapes and forms. Some of them are noted here. That might be the reassurance seeking. They may make it so that they physically don't go. There could be ways of like closing their eyes or shielding themselves behind you. All of those are ways to lessen the anxiety in a way that makes it so they don't sit with that anxiety and learn bravery. We want to remember here is that the reason avoidance is problematic is that it's a behavioral response to that strong emotion. And what it does, that behavioral response takes away a child's opportunity to learn self-efficacy, to really grow their confidence, to have choice and fun and freedom. It might make them miss out on play dates, make them miss out on school projects that maybe they would actually really love. And so it's actually a Band-Aid that's creating a much larger wound. We want to remember here that kids can face their fears. We just need to help them recognize and build access to their own coping skills. Next slide, please. But not having our kids avoid can be really challenging, and that's why accommodation occurs. Accommodation can also take on lots of forms. I encourage you to take a look at the list here and see if you notice that you do any of these. I want to be really clear and say that we all get pulled to at times. I'm a trained CBT psychologist, and kids in my sessions, their anxiety gets so high it pulls me to accommodate. I'm just trained to recognize it and know a different way to respond. So one of the things we want to think about is how can we recognize the accommodation we're being pulled to, name it for ourselves, and come up with a better strategy. Next slide, please. Okay. So when kids are having problematic worry, problematic anxiety, here are some of the strategies that can help. Okay. So instead of, like we talked about, telling them to stop worry, no, that doesn't help. What we want to do is become collaborative as a team, and actually what we call externalizing the anxiety, take it out from inside of them as a problem and kind of pull it out, name it, and work on it together. We have this little example here of saying anxiety is making it hard for you. Rather than you're scared, stop worrying, name the anxiety. For younger kids, we'll even have them name it, come up with something like the worry monster, the worry bully, older kids as well, that annoying pest, and then start naming that. That's what's coming up for us, because then it pulls the problem as something we can all work on together. The next thing is, rather than jumping in with advice, which we all want to do, we want to help kids, it's a natural feeling, is instead to encourage their own bravery, their own self-exploration, their own problem solving. Like, what do you think you can be brave and try? Okay, what do you think you can problem solve and do? Rather than giving excessive reassurance of it's going to be okay, it's going to be okay, it's going to be okay, try to have them come up with that own reassurance for themselves. We call those coping statements. So here I have an example of fear is temporary and harmless. No one ever died from a thought. There's many different coping statements we can come up with for kids, like this is hard, but I can do it. I'm scared, but I can be brave, and have them repeat that to themselves. Have them say it to themselves as their own coach. That really helps them build their own internal resources. Rather than allowing avoidance, what we want to do is give them coaching statements. So this is hard. Acknowledge it. It is. And I know you can do it. Have that confidence. That's kind of like that good coach you might have had as a child, or a good teacher who knew it was challenging, but knew and believed that they could overcome it. The last one is, rather than punishing or shaming, which I don't think any of us mean to do, but it can sometimes happen by their tone or the way we respond. We want to give as much warmth and confidence as possible in our children. We want to model bravery, model strength, and do that in a warm, supportive way. So here I have, okay, anxiety got the best of you today. It was really high. We're going to try again tomorrow. Great job working on your bravery today. We're going to keep building those bravery muscles. That acknowledges that anxiety was high, but that we're going to keep working on it, and that it's okay that that happened. But we're going to keep going. We're going to try again. We're not giving up. We're not going to back down. Okay. Next slide, please. Okay. So let's say you're using those strategies. You know avoidance and accommodation are problematic behaviors, fueling that problematic anxiety. Let's just stop them cold turkey. Just stop doing it. Well, some people could technically respond to that. It's really not recommended. The key in reducing avoidance and accommodation is to be gradual. So thinking about, like, if you taught a kid to swim or when you learned to swim, while throwing someone into the deep end or having them just dive in could work, more likely than not, what it's going to do is actually make them really resentful and increase their fear and avoidance. They'll think the terrible thing is going to happen. So let's not dive into the deep end, but be collaborative with your kid and think about how, more like how you taught them maybe how to ride a bike. So work your way up from a tricycle or a balance bike, I guess everyone uses nowadays, to training wheels, maybe one training wheel when they're ready, to holding the back of their bike, to slowly letting go, to standing watching them bike, to letting them go on their own. We have to be gradual in a timed manner, in a collaborative way with our kids. Next slide, please. So today's webinar is informational only. It's not diagnostic, and it's not going to provide therapy intervention, just some suggestions. If some of the warning signs for problematic anxiety really resonated with you, or you noticed them in your child or teen, we recommend you reach out to your child's pediatrician or seek an evaluation from a cognitive behavioral therapist where you can discuss your concerns and learn if maybe your child does have an anxiety disorder and what the right treatment is for them. Next slide, please. So we went over a lot today, and we really just scratched the surface. Anxiety is a dynamic and complex thing and unique to each person. There's some really common threads, but if you're interested to learn how and more about the strategies in much greater detail, consider joining our upcoming 4-part psychoeducational small consultation group that I'll be leading starting shortly after this week. You're going to receive more information in an email after today's webinar about that program, and I encourage you to explore if that may be supportive for you. Next slide, please. And Dr. Reichert, we'd love to have you join us now so that we can respond to some questions from the attendees today who took time to be with us.
Wonderful. Thank you so much, Drs. Fedigan and Dr. Leger. This was a wonderful presentation. And I have just been here compiling some of the questions. And so I think the question I'd like to get started with today is with kind of going back to this piece around accommodation. And so you've talked a lot about, not having our kids avoid what makes them feel anxious. And so one of kind of several questions that came through were around this idea of, well, what if my child becomes so anxious that they begin to panic and they can't seem to handle that moment?
Sure. I'm happy to answer that one. So I'm really glad someone raised this. It's an important piece that I didn't spend time going over today. People often refer to things as panic attacks or anxiety attacks that happen. Now, kind of a small word on panic and anxiety is sometimes anxiety does get so high. We think of it as a wave where it kind of is growing and growing and growing. And sometimes it does hit a crescendo where it's so high that at that point, any human is in a fight or flight mode, and they're just not able to access internal resources to tolerate the distress and continue forward. In those moments, we want to pause. We think about it as riding the wave out. And there's definitely a way you could ride a wave that may make it more challenging for yourself or more smooth. And what we want to do in those moments is be a coach to our child of anxiety's really high right now. The wave is crashing, and think about what can we do to help them ride that out that is calm and soothing and coaching. So when kids do have these anxiety crescendos, these panic moments that do happen, that's where, rather than saying, okay, it's totally fine, we're not going to do anything, we want to recognize what is happening, label it for them because it can be very scary and overwhelming for them. And then also to coach and guide them through on soothing and calming things. After the panic or the anxiety crash has ended, that's a time to go back later and talk about what happened. Talk about how we can plan for it ahead of time, look out for the warning signs that wave is rising so we can have a better plan together in the future. It's not a failure. It's not a setback. It's a learning and teaching moment. And those actually can help build bravery. We don't want to encourage them and say, let's just like throwing the child in the deep end and building that panic, but sometimes they occur, and that's natural too.
Thank you, Dr. Fedigan. That was incredibly helpful. Both of you mentioned this notion of using relaxation as a coping tool or coping strategy, and several parents have reached out asking, what are actually some strategies that you in your practice have found work with kids, both with younger kids, with older kids, and if you could cover across the age group, that would be helpful for our audience.
Yeah, definitely. So maybe I'll take that one, Dr. Fedigan. There are, exactly as you mentioned, there can be different strategies that are useful for different developmental, age periods, which is really useful. So I know that, we kind of mentioned some of the broad ones or relaxation techniques like deep breathing, visualization, and grounding. Breathing can be really useful. It's one of those great ones that are useful across the different developmental ages, but maybe done in different ways. ways. So for example, with younger kiddos, fun things like smelling the rose, where you're going very slowly and through your nose and kind of blowing out through your mouth, or blowing out birthday candles, of kind of using these visualizations as a way of practicing the skills. One of my favorites is like having a bowl of soup in your hands and smelling the soup and then blowing out the soup to cool it down. For some kiddos, having bubbles around and kind of blowing out the bubbles can be really useful. And another fun one can kind of do with your kiddo is to lay on the ground and have a stuffed animal placed on, kind of one on your stomach, another on your kid's stomach, and breathe in and out. And as you watch the stuffed animal go up and down, you can even make it a little bit of a competition if that's something that your kid's into, and can make it a little bit more fun, but really helpful to kind of practice those skills, use those skills. And again, like a muscle, the more you do it, the easier they are to use and obtain when in those kind of more stressful, more emotional headspaces. For older kids, some of the breathing is definitely very useful. The visualization, grounding. I have many teens who actually appreciate the Calm app. That's one that's really useful in kind of, walking through these exercises together, and that's been really nice. But I think also to remember, which can be really useful both with general stress and with kind of anxiety, is using that self-talk. So creating those kind of phrases to tell yourself, for that self-coaching, which is so important. Progressive muscle relaxation. And you can search online when there's tons of really great scripts. For young kids, it can be something along the lines of, crush lemons in your hands, tight, and then stretch like a kitty cat. And then for kind of the older teens, really just walking through those different muscle groups. Some teens really like doing it at night because it helps them also with sleep as an additional bonus, which is super helpful. Keeping a diary can be really useful, and journaling and getting kind of all those thoughts down on paper. Goal setting also for the teens, being really thoughtful about creating attainable small goals that they can work towards. And I know, like I kind of noticed in the chat, there was a question about COVID also in terms of using these coping strategies. And I think that really having those conversations, those open conversations about what's really going on with them, understanding that this is a time when, we do know certain things, there's some things that we really don't know, but we're going to really try as much as we can to be secure, modeling that bravery, doing that for yourself, but having it be an ongoing conversation can be really useful, in addition to kind of all these strategies that we've mentioned today.
And something jumping off, Dr. Leger, you mentioned that I love is that relaxation is a muscle. As you mentioned earlier, this is a practice. And so practicing actually when they're not anxious or in a really calm state helps build that muscle so that if and when a more challenging situation arises, it's more readily available to them. So if we only practice when we're anxious, most people will be like, I'm not trying that. That's a really normative response. So building it into everyday practice, having it be before bedtime, where when you're snuggling in, you practice your deep breaths, doing one of the many wonderful apps that can be more visual. All of those help build that muscle for when you need it.
I appreciate you adding that piece, Dr. Fedigan, and just one of the routines we've added into my son's bedtime routine is the strategy, Dr. Leger, that you talked about of the stuffed animal on his stomach at the end of each night, and that's part of the way that we kind of just calm down and wind down. So I love that one. Thank you for sharing that. There was another question here around caregivers and working as partners. So caregivers that are having more than one caregiver in the home, or having multiple caregivers in the home, and just wondering, if you have any tips or strategies of how caregivers can become more aligned or get on the same page if they're not aligned on some of these areas, as that also creates more stress, right? So
I'm happy to start with that one. So I first want to just normalize that it's extremely hard. It's a challenge. It's also not uncommon at all. We all, as humans, have different models of parenting that we got from our upbringing. And so, I mean, we're all different people. We didn't come from the same household when we have kids. And so we're bringing in different thoughts and life experiences. It's just really only natural to have those differences as parents. And it can be a real strength at times to have different parenting values and thoughts, right? But when it comes to a head like that and it's a challenge, what we want to do is really focus on how we can align our values, focusing on major things like maybe house rules. What are the big sticking points? So we have a framework to work from, even if maybe in the nitty-gritty moments, there's some differences in how parents approach things, which would happen. There's different personalities. But the foundational strategies of, okay, like how are we going to respond to a tantrum? How are we going to respond when they refuse to go to the play date because there's a dog there? Can we agree what the 3 steps we're going to take together are? And so I think aligning on those major pieces or finding a way where you can find a common value, whether it's valuing bravery, valuing problem solving for your child, will be that kind of really helpful fulcrum, knowing that you're not going to align on everything. And that's okay. It's aligning on the major ones.
That's great. That's super helpful. Thank you for that. I'm noticing our time and we have about 5 more minutes. So hopefully we can get in a couple more questions here. There was another question with regards to kind of thinking about the kind of the warning signs of a pediatric anxiety disorder. And I know you had that wonderful slide, Dr. Fedigan, of kind of some of the different things to look for. And the question that came through was really pertaining to, does it have to be just 1 or 2 of those signs that may indicate that my child has an anxiety disorder, or does it have to be all of those things, or how do parents know, when to kind of take it to that next step to seek help?
So I'm happy to jump in here. And I think there can be a constellation of things to kind of look for. And I think it's a really great question because it can be so hard. And I'm hoping something that we were able to kind of communicate through this presentation is that it can also exist on a spectrum, but that spectrum, because there's so much overlap, it can be so challenging. And so to kind of directly answer the question is, no, not necessarily, but it can really be a combination of what's happening for your child. And so I think that the reason why we wanted to talk about them is just so that parents are aware of kind of things to be looking for, but ultimately also thinking about how that affects their functioning. So again, is this really getting to a point where they can't do things that they once really loved to do or wanted to do? Is it stopping them from kind of engaging with others or doing things that they want to try to do, but it's kind of holding them back in some way, and thinking about it. I mean, ultimately, if there's any concern, I would absolutely bring it up with your pediatrician. I would kind of seek a consult because I think that's just an important part of the process. But there, unfortunately, there isn't any clear cutoff because it kind of does exist in this constellation.
Yeah, and they certainly don't have to have every symptom. Exactly. It's kind of these are the different areas of flags to look at.
Yeah, that makes a lot of sense. And I appreciate, Dr. Leger, the comment about seeking a consultation with your pediatrician as a great first step, because that can usually be someone that's quite accessible, and you can get an appointment fairly quickly for that sort of a check-in. Knowing that sometimes getting to be seen for a psychiatric consultation or with a psychologist can sometimes take a little bit longer. So there was one additional question just regarding this notion of it sounds like one parent has really taken some steps to actually try to stop responding to some of their child's repetitive questioning or their anxious thoughts, and that parent saying that it's actually getting increasingly more difficult because it seems actually to be making the situation worse, and so I'm wondering how you might respond to that.
Certainly, I'm happy to jump in, but Dr. Leger add in as well. I'm smiling because it's such a common phenomenon that I'm so glad someone brought this up. So we actually know this phenomenon so well that it's labeled and studied as something called an extinction burst, where when we're first trying to change, if we think back to that cognitive triangle of Beck's, if we think back to that, and this is a pattern that has worked for the child to relieve their distress, it's their go-to strategy. When we start to remove that, it's really natural that the anxiety and stress actually increases. It gets worse before it gets better. And so often what we see is that the anxiety can get higher, which can mean that the resistance can get higher, the avoidance can want to get stronger, the irritability can get stronger. We call it an extinction burst because it's a burst. It won't last forever. The idea here is that we want to ride it out. As humans, if something we know worked just stops working, even imagine your password when you put it in your computer, you try it a couple more times, keep trying, right? The challenge is anxiety isn't just putting your password in a computer, it has a lot of weight, right? So what happens is that it escalates. Eventually, it will come down if you are able to, in a warm, supportive, coaching way, hold firm of, I know anxiety is getting harder and I know you can do this. It's a burst because it will go out. It's kind of anxiety's last ditch effort to hold on and grab avoidance and see if we can get parents or other grownups to break. Now with that, I just want to have one more caveat because I know we're ending, is that if we do give in and help accommodate in those moments, it's actually at the height of what will reinforce that in the future, they're going to go up to that level of anxiety and distress again to try to get you to accommodate. So we really want to try to recognize that this is a known phenomenon and process. And the more you can acknowledge that and try to hold back from accommodating in those moments, the greater the long-term success you'll have.
Thank you so much for answering that question. I recognize we are out of time for today, but please look in your emails for a follow-up email with information about upcoming events. And we thank you, Dr. Leger and Dr. Fedigan, for being here today, as well as all of our attendees. Thank you so much for joining us.